pleasure for me to announce today's award. And Salma has been a personal inspiration, a shero for me. Salma Abugideiri is a licensed professional counselor in private practice in McLean, VA. She received her master's degree in counseling from George Mason University and completed a postmaster's certification program in marriage and family therapy at Virginia Tech. She provides counseling to individual adults, couples, families. Counseling services treat many problems, including mood disorders, anxiety disorders, spiritual issues, trauma, abuse, cultural adjustment issues. But why I love Salma and her work is she is the founding board member and primary trainer for the Peaceful Family Project, an organization dedicated to educating Muslim community leaders and members about domestic violence. We know domestic violence is an ethical
check something. Let me check. No, I think.
the likes of you.
Okay, we're good. Sorry about that. We gotta change battery. Yeah, we're on. We're unmuted. Dr. Beth, sorry about that. We just changed the battery. You can continue if you like. Sorry.
So, do we have Salma?
Yeah, I'm here.
Okay, so
Yeah, thank you. I wasn't able to hear what you were saying though.
oh, okay, I can repeat it.
But thank you.
I was appreciating you as a shero, as an inspiration for myself. I appreciate you being a strong contributor, partner in this work on Muslim mental health, but especially your work with Peaceful Family Project. I think domestic violence is an ethical, moral failure, and families are the cornerstone of our community. So we really appreciate all the great work that you are doing, and we wanted to give you this token award in lieu of all the great work you are doing, and hopefully will continue to do.
Thank you so much, Dr. Farha, for that very warm welcome. I've been asked to speak for a few minutes, so I will do that. You're actually one of my sheroes as well, so it's very humbling to be here. I'm just gonna talk a little bit about my journey, and hopefully, you know, the people here at the conference will kind of get a glimpse of the significance of where we are today. And a lot of that is due to Dr. Farha's efforts. Approximately 15 years ago, I think it was, I was doing a presentation for some youth, and a high school student came up to me and she was in tears. And she said she wanted to study psychology. And she said, the problem is that my parents have told me studying psychology is haram. And so I looked at her and I just started laughing. And, you know, I said, I guess I'm going straight to hell. And then, you know, we laughed together and I talked to her. By the way, this is not an indictment against any of you that are here, all of you Muslim mental health professionals. I'm really deeply humbled and I'm honored to receive this award. A long time ago, in what feels like a galaxy far, far away, I was hard pressed to find a single Muslim mental health professional that put their Islamic identity first and also wanted to work with Muslims. So that combination was really hard to find. And now look at us. Look how many of us there are just at this conference. It really is overwhelming and deeply gratifying to be among so many of you today. I want to thank the organizers of this year's conference for deeming me worthy of this award. I thank the visionaries who have given all of us this community of learning and connection. I have the utmost respect and appreciation and admiration for Dr. Farha Abbasi for starting this conference, for Dr. Hamada Hamid Al-Talib, Dr. Halim Naeem. We've all seen their efforts over so many years bringing us together. You're the ones who deserve an award, but I'm not going to give up mine. I'm going to hold on to it. This is very special for me. I feel really humbled to be recognized by people that I feel have done far more than I have, who have benefited our professional community in broader and deeper ways, such as organizing this conference, establishing the Institute of Muslim Mental Health, creating the journal, Muslim Mental Health. I know I'm really only here by Allah's grace and guidance. There were many people along the way who said that I shouldn't, that I couldn't, and that I wouldn't make it. There were also some people who inspired and encouraged me. I really have to credit my parents first and foremost, because they were my role models. They modeled serving the community in a way that many of us would never be able to do. I learned firsthand that we as Muslims have so many unmet needs when it comes to mental health. So I grew up in a home where my parents really literally took in and made space in our home for abused women, for women who were divorced, adolescents that were having trouble getting along with their parents, people who struggled with their religious identity, and many others. You know, I grew up watching my parents on the phone and in person for hours, providing informal counseling to people who were having marital problems and who were in abusive situations and were struggling with mental health issues. I wanted to be like them. I wanted to help others, but I confess I really didn't want to have all those people in my house. So I had to find another way to help. When I graduated high school, I told that I wanted to study psychology. Some of my father's friends, most of whom were physicians like him, they told me I would be wasting my brain. My father also had friends who were community and religious leaders, and they told me that psychology is a product of the West. Of course, we know that they were wrong, and that Muslims don't suffer from emotional problems because they have Islam. You know, as we read the Quran now through a lens of psychology, we can see that the Quran is actually a book of psychology. But I didn't really know that then, and these comments were definitely demoralizing. Some of these people asked me, what did I think I was going to do with a degree that was obviously irrelevant? Somehow I've managed to stay busy in spite of that. Not to mention, they asked me, how would I protect my deen if I was going to study Western psychology? Back then, I didn't realize that I was a fighter. Apparently, I took all of these negative comments as a challenge. I also didn't really know what I was in for. I studied psychology in the mid-80s, 1980s. I did say a galaxy far, far away, didn't I? For context, in that galaxy, there was no World Wide Web, what we now call the internet, or social media. There was not even cell phones. So it really wasn't easy to connect with people that could have been my mentors, people like Dr. Malik Badri, may Allah have mercy on him, who I was blessed to finally meet in 2018. Back in the beginning of my journey, I often felt quite alone. I had a lot of moments where I just wondered, am I making a mistake? I was really horrified when I sat in my undergraduate psychology classes as I was learning about Freud and learning that religion had no place in the therapy room. I really wondered, was I going to be able to practice in any authentic manner? Whenever I would meet Muslim psychiatrists at Islamic conferences, I would shyly approach them and ask them, how did they integrate their Islam into their treatment? Without fail, they all said the same thing. We check our values at the door. Religion is a private matter. I knew that wasn't going to work for me, but I didn't really know how I was going to make it work. Until I met Sister Shahina Siddiqui, another one of my shiros, who was one of the visionary founders of the Islamic Social Services Association, along with Dr. Anisa Nadir and others. She shared her paper on spiritual counseling with me. I read it, and I hoped that one day, when I had my own practice, I could practice in an authentic way, integrating Islam into treatment. In the meantime, I figured I'd have to practice secretly, because at the time we were trained that religion had no place in the therapy room. I took the scenic route to becoming a therapist. I stopped along the way to become a mother and do various odd jobs along the way. The scenic route took so long that I actually forgot I wanted to be a psychologist. Instead, I started a graduate program in teaching English as a second language because I had really enjoyed teaching adults English as a second language, the county's program. But I discovered I hate lesson planning. I'm indebted to my brother-in-law who reminded me of my original dream when he heard me complaining. So I applied to the counseling and human development program at George Mason University. Although I don't have any evidence, I think I might have been the first Muslim who went through that program. I certainly was the only one in my cohort. During the graduate school admissions interview, the professor, who later became my advisor, asked me why I wanted to study counseling. I told her that I wanted to fill a gap for Muslims in the field of mental health, that I knew Muslims needed the help, but that they weren't getting it. So she said that she had been living in Egypt for a few years, and she knew for a fact that Muslims were not interested in counseling. And so she wasn't really sure how I was going to make a career. So I told her, that's fine, I'll provide therapy to anyone who's in need. And she said, well, I don't remember exactly her words, but what stayed with me is, given how you look, do you really think that people are going to connect with you as a therapist? And I said, well, then I'm going to work with whoever wants to work with me, and whoever doesn't, I'm happy to refer out. Underneath my bravado, I prayed that she was wrong. Today, I know for sure she was wrong, because all of the Muslim therapists that I know in Northern Virginia have a waiting list. It's very hard to get an appointment. So we are definitely in demand, and we are definitely providing a service. Back then, I would have done anything to be at a gathering like this one. All I wanted was to meet a Muslim therapist or psychologist or psychiatrist, anyone who put their Islamic identity first and was committed to serving other Muslims, still an underserved population. I didn't know it then, but the detour I took, the scenic route of becoming a mother, turned out to be very helpful because it yielded my first, youngest, and only fans at the time, my sons. As young boys, they frequently told me they were proud of me as they watched me go through graduate and then postgraduate programs, when they watched me studying for the board exam during football practice. And finally, when I opened my own office years later, I'm grateful to each of them. And I'm so proud of them. It's funny, when I look back, I remember one of the boys, he was in elementary school. We were sitting at the kitchen table. I had just, opened my own office. I had one client in private practice. You always have to start with one. And my son took a napkin and he drew on this not very clean napkin, and he wrote some business projections. He asked me, how much I needed to earn. And then he did the math, how many clients I needed to see each day or each week, how much I had to charge. And then knowing me, he knew me very well. He said, Mama, you have to actually collect the money from these people. Years later, my other son would write the chapter on finances in the book I co-authored with Imam Majid, Before You Tie the Knot. So I was not good at the business side, and my kids knew it, and alhamdulillah, I had their support. In terms of how I approached the clinical aspect, integrating Islamic values into my treatment Whether, these values shape me personally and myself, and the self of the therapist, or whether I use them explicitly in treatment, I again credit my parents, because they really modeled an integrated Islamic identity. But in the clinical setting, I credit my first client. So for those of you who might have read my work on domestic violence, or if you've ever attended a workshop run by Peaceful Families Project, you might have heard this story before, but it definitely left a mark on me and shaped who I am. I was still an intern. I hadn't graduated yet from my master's program. It's a wonder that they even let me loose, to provide therapy. But I was sent to do home-based counseling for a young immigrant Muslim woman. She had a son who was probably about 8 months old. She had been severely beaten and abused during her pregnancy, and she gave birth to a son that was born with serious neurological impairments. So not surprisingly, she was depressed. I sat in her kitchen. I listened to her story of being divorced by her abusive husband, shamed by her family for giving birth to a son with disabilities, and I was overwhelmed. Her son was in the kitchen. He was lying in the bassinet. He had a feeding tube. She told me he'd never be able to walk or run. I sat there and I visualized my own 2 sons, very healthy, running, climbing, reading, definitely feeding themselves. I fell apart. I actually started bawling. I barely managed to get the words out and ask her how she had managed to cope so far. She smiled, she turned around and pulled a book from the shelf behind her. She opened the Quran and she read some verses to me. That was a critical moment for me. It cemented that Islam is a tremendous resource that we have, and that we can use our religious teachings to strengthen our treatment with clients for those, for whom those teachings resonate, of course. It was also the beginning of my training in domestic violence, which was a completely hands-on training and nothing that I learned in graduate school. Thankfully, in my internship placement site, which later became my place of employment for several years, I was given a lot of free rein. I credit the director of the agency, Dr. Dennis Hunt, for tasking me with reaching out to area masajid to build relationships and foster trust so that Muslim community members would actually seek our services. Still, I used to wonder in my office what would happen if I got caught using Quran and Hadith in sessions that were funded by state and federal dollars. I'm grateful to Dr. Jean Coleman, one of my clinical supervisors in the Postmaster's Marriage and Family Therapy program at Virginia Tech, who's responsible for helping me incorporate Islam and spiritually into my practice in an open way. She supervised me from behind the mirror. I don't know how many of you got your training that way, but she called me on the rotary phone that sat next to me in the therapy room. I was working with a Pakistani Muslim woman whose husband had abused her. I don't remember what we were talking about, but I do remember the phone ringing and I picked it up and Jean was on the line. And she said, "Isn't there anything in your religious teachings that you can draw on to help her?" She's obviously a spiritual woman. I was really stunned. A lot of things ran through my mind. Was I being set up? I mean, the clinic was in a state university. Wasn't there a separation of church and state? On top of that, I was being videotaped. And again, to my knowledge, I was the only Muslim in the marriage and family therapy program at that time. But that was a turning point for me. I'd already been secretly integrating Islamic teachings into my practice in the few years I'd been working before that, but I finally stopped worrying about being found out. I was free. Hadn't actually been suffering from any kind of diagnosable paranoia. For the sake of context, I learned at a young age, maybe like others here, to censor myself. I looked Muslim because I wore hijab from a young age. Although people where I was growing up didn't have any idea what Muslims were. People would come up to me and just ask, "What are you?" Other people just assumed I was a nun. Not that I've ever met a child nun, but that's what people, they try to put you into a category that they understand. I was bullied, like many of you, by students and teachers alike. And as an adult, my clinical supervisor at work, who came from a place where she was definitely familiar with Muslims, but did not have a very positive association of Muslims. So she took every opportunity to just label me. And, you know, as an introvert, she would attribute my lack of speaking up in a group setting as, you know, the submissiveness that's part of being a Muslim woman. I remember once in a meeting with the other interns, somebody was presenting about FGM, female genital mutilation or cutting. And she said that it was no different than hijab in its intent to oppress women. I wasn't the only Muslim, but I was the only one who was visibly identifiable as such. But you can imagine what a relief it was when I felt that the establishment accepted and encouraged integrating spirituality and Islamic teachings in a manner that was viewed as powerful and instrumental in facilitating healing and transformation. I also owe a debt of gratitude to others who helped me gain credibility as a therapist. When I started practicing, many people really didn't trust therapists, even though I was Muslim and part of the community for a long time. And so I have to really give credit to Imam Muhammad Majid, who is part also of the cultural change in overcoming the stigma of mental health. I did present with Imam Majid at this conference 3 years ago. He does not miss an opportunity to talk about mental health, weave it into khutbahs, workshops, classes. It doesn't matter what he's teaching, he finds a way to talk about mental health and counseling. He's always encouraged people to seek counseling, and he was instrumental in the collaboration that currently exists between the Adams Center, which is a very large Islamic center in Northern Virginia, and a lot of the Muslim mental health professionals in our area, where Muslims in the community who are either uninsured or for other reasons might not be able to access services are able to do that through Zakah funds. In the early days of my career, you know, people would call me up. I'd, you know, always be excited when I got a call, you know, for a new client. And I would hear a person on the other line say, Imam Majid said I had to call you and make an appointment. He said I had to have a counseling appointment with you. I want you to know, I don't want to see you. I don't believe in counseling. Only coming because he's refusing to see me again before I meet with you. If it were ethical to give referral fees, Imam Majid would be a rich man. I want to acknowledge the growing number of imams and chaplains around the country who are not only supportive of our work, but who are contributing to overcoming stigma and barriers to accessing mental health care. And, you know, as I used to do more of this before COVID, traveling around the country and doing workshops, meeting so many imams who are dually trained. I want to appreciate all of you who are doing training for imams in mental health first aid and engaging in collaboration with them, because they really are instrumental partners in creating cultural change. Yes, we are a long way away from the days when I was told I might burn in hell for studying psychology. A lot has changed since then. Give you an illustration of how far we've come as a mental health community. 2002, when I opened my first upper office, where I actually had a waiting room, my clients would hide. All of my clients were Muslim. My clients would hide at the end of the hallway until the next client came into my office, just to avoid being seen. There was that much stigma. In 2020, up until the pandemic, and that's the last time that I've seen clients in person, I would go out to the waiting room and see my clients with other therapist clients, socializing, drinking tea, talking openly about their therapy. And I would actually have to interrupt their socializing to drag them back to the therapy room so we could have our session. That tells you how much has changed. I've also had clients who use public speaking opportunities to talk about their own personal counseling, to advocate for others to seek counseling, and to advocate for counseling being seen as prevention, just like we go to have our teeth cleaned at the dentist or a well visit at the doctor. So I know that for some of you, depending on where you live, you haven't seen this cultural change yet, but it's going to happen. It's happening as we speak, because so many of you are actually creating it simply by being here at this conference. People are doing this on a level, like the conference organizers, Dr. Farhad, Dr. Hamada, Dr. Bumi, Dr. Hamad, Dr. Sadiq, people like Dr. Rania Awad at the Stanford Muslim Mental Health Lab, people like Dr. Human Keshavarzi and Dr. Fahad Khan at the Khalil Center, people like Samira Ahmed, Dr. Samira Ahmed and her team at the Family and Youth Institute, just to name a few. And people like each one of you who are doing research, you're providing therapy, you're teaching. Each and every one of you is making an impact in others' lives, and you're changing the landscape as we speak. As an undergraduate, in that faraway galaxy, when I first started researching mental health in Muslims, domestic violence in Muslims, by the way, I used a paper card catalog, which some of you might not even know what that is. Just flipping through all those cards, hundreds and thousands of those cards, to find one paper, something about Muslims. And most of the things I found were basically research that was being done overseas. So when I received the first volume of the Journal of Muslim Mental Health, I sat in my office and I cried. I'd already been out of graduate school for 10 years. Still, it was incredibly validating, affirming, and inspiring. And look how many volumes we have now, online public access. It's amazing. It's really part of that sea change. Dr. Hamad Hamid and his team deserve so much recognition for his leadership and persistence with that journal. We've come so far as a community of Muslim mental health providers and researchers. You know, having the keynote speech tomorrow on domestic violence, that's amazing. It's tremendous. Domestic violence was a topic that we couldn't speak about in any credible way. People would tell me that domestic violence doesn't exist in our community, right? And we know now that there's so much amazing work being done to address domestic violence and to prevent it. So as we're here together in this conference, I wonder what the next frontier will be like. This conference brings cutting-edge research to the global mental health community. We as a community are making a difference in how clinicians around the country and around the world treat mental health disorders, provide marriage and family therapy, and address domestic violence. We are breaking the stigma and normalizing therapy as a help-seeking behavior. We're changing lives, we're making the world a better place. So I challenge each one of you to think about your role and what contribution you want to make for our evolving and growing field. Know that every step you take, no matter how small it feels in the moment, no matter how many obstacles are in your way, remember that every one of those steps leads to a large change over time. May Allah subhanahu wa ta'ala bless each and every one of you and grant you success in your endeavors. Thank you so much for allowing me to be part of this beautiful community and for honoring me today with this award.
Thank you. Really, your journey has been the journey of Muslim mental health. So thank you for sharing that. And our best to Imam Majid. He was the first Imam to endorse my work, endorse this conference. So Jazakallah for that. And we need so many more of like him. And inshallah, the work continues. Thank you.
You're welcome.
Thank you so much. I think right now we kind of finished a little bit early, but we can start with lunch break. So I know you're all hungry. Couple of things. So for Jummah prayer, it's going to be here at 1 p.m. Just giving you a heads up. So please spread that word to your colleagues. And the second thing is for anyone on Zoom as well as here, we're going to put the CME instructions on how to get the code. All right. And anything else? Yep, and we will come back at 1:30 for the next session for track A and for the other tracks. That's it? Okay, perfect. So I'm just going to put up the slides right now, so thank you. And anyone in the audience, if you don't have a CME, it's okay. You guys can head out and go get lunch. have lunch. We're gonna look into it. I think we have lunch.
There's box lunches, it's on the Waffle app, there's a message.
Oh,
There's box lunches and it's at, Med Cafe.
oh yeah, Med Cafe, that's correct. Yes, Med Cafe. Let me get the. Yeah, I'm just gonna put the slides right now. 1 second. Yeah. Yeah. Leave it there. All right, perfect. So we'll leave that there. I'll just. Yeah, we can leave our laptops here. And on. Okay. Hang on a second.